All right. Well, hello and welcome to the August meeting for the Rural Learning Community. We hope you enjoyed your little break in July. On behalf of the American Cancer Society and the National HPV Vaccination Roundtable, I want to thank you for taking time out of your busy schedules to join us today, whether that's live or via recording in the future. We will be offering live CME and CNE credits for today's session. Today's session will be an engaging discussion on how trusted messengers can help improve cancer prevention and screening efforts. I do want to note that this program is supported by a grant from the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services. If you want to go to the next slide. So, for those that haven't met me yet, I'm Ashley Locke. I'm a program manager for knowledge translation at the American Cancer Society. I have the privilege of leading the rural learning community as a part of a dedicated team at the American Cancer Society and the National HPV Vaccination Roundtable, working to improve HPV vaccination, cancer screening, and support for rural communities. If you want to go to the next slide. So I can't believe it's August, and I just actually sent my kids off to school today. But as we're in that flurry of back to school season, wanted to see if all of you could add to the chat your name, organization, and strategies that you have used during this back to school season to encourage HPV vaccination. So I will go through those in a little bit, but please, if you would like to add some information in the chat, we would love to hear from you. If you want to go to the next slide. So while you are adding things to the chat, I'm just going to quickly review our agenda for today's call. So in just a minute, we'll be doing a quick poll. And following that, you'll hear from my colleague, Jennifer Nagy, who's a cervical cancer survivor. After hearing Jen's story, we'll transition to our robust discussion on trusted voices and community messengers. I do want to share a few quick reminders. So all of our rural learning community sessions are recorded and posted to a public-facing website. So please turn off your camera if you don't want your image recorded for whatever reason. This session is certified for live CME and CNE credits. We have added a link to the chat detailing out CME information for today's session. I do want to note two of our presenters have disclosures. Dr. Vasudevane has received contracted research with MSD, and Dr. Ashanda St. Jean is a part of the Speakers Bureau for Pfizer. However, no other planners or panelists have anything to disclose. We will ask all participants to stay muted until our panel discussion. However, the Zoom chat will be open for questions and support. If you want to go to the next slide. So for today's discussion, we'll be focused on the following learning objectives, discussing culturally responsive HPV vaccination interventions that resonate across diverse rural populations, and then comparing best practices and challenges in increasing HPV vaccination in rural settings. If you want to go to the next slide. So before I turn it over to my colleague Jennifer, we're going to start with a quick pre-session poll to have you share your familiarity with trusted messengers and screening efforts, with prevention and screening efforts. So I'd ask that you guys go ahead and take that poll for us. In the meantime, I'm going to review the chat and see who has provided us with some things that they've done in the back to school season.
Hi, Ashley. Just letting you know that the poll is not on the screen right now. It was for a second and it disappeared.
Okay, hang on one second here. Did that work?
Yep, back on. Thank you.
Perfect. Thank you. All right, I'm looking at the chat. Maddie McNee from St. Jude's HPV Cancer Prevention Program shared that It's Our Way Down South has resources at back to school immunization events, so that's very exciting. Marcella DeSantis from Inland's Empire Health Plan recently hosted a back to school wellness event offering well care visits and immunizations. That's very exciting to hear. Stacy Wesley shared that they are ensuring patients are scheduled for their annual well child exams as well as second dose HPV nurse only visits to complete the HPV series. That is very exciting, Stacy. We've been trying to regularly share the information about the benefits of HPV vaccination, especially that it's cancer prevention. That's exciting to hear and very important. Mary shared that they are creating Facebook posts for back to school outreach, mandatory school vaccines, how to look up your immunization record, benefits of the HPV vaccine. So many great things. Back to school physical fair. Very exciting. Kelsey shared that we have currently promoted all vaccines through back to school promotional campaigns and highlighted our upcoming back to school immunization clinic in which we will be collaborating with a neighboring health department. Clinic will be held at a school near the county line. That's very exciting to see the partnerships come through. And Kelly Welch shared that T. Maureen in Massachusetts is attending a back to school bash with HPV info. So that's very exciting as well. If you are just joining, we are doing a quick poll just to see where everyone's knowledge is at when it comes to trusted messengers. Looks like we have 49% who have participated. So in the interest of time, I'm going to go ahead and end the poll. And I will share the results with everyone. It looks like on a scale from 1 to 5, how familiar are you with strategies that use trusted community voices to promote cancer prevention and screening? It looks like majority are at a 2 or a 3, so slightly familiar or moderately familiar. Which trusted messengers have they partnered with? It looks like cancer survivors, community health workers, immunization coalitions, and school nurses tend to be the top 4. So that's very exciting. So thank you all for sharing and being a part of that poll and also sharing what you've been doing with the back to school season in the chat. So I am now excited to introduce my colleague, Jennifer Nagy. So Jennifer is an Associate Director of Cancer Center Partnerships at the American Cancer Society. Her passion for this work is deeply personal. As a 19-year cervical cancer survivor, Jennifer understands firsthand the challenges, fears, and uncertainties that can accompany a cancer diagnosis. Her own cancer journey, combined with the support she received from the American Cancer Society, inspired a lifelong commitment to raising awareness of the organization's mission and its life-changing programs and services. Jen has graciously agreed to share her story with us today, and we've included her full bio in the chat along with information on how to connect with her. Jen, thank you for being here today, and I'll turn it over to you.
Thank you. Appreciate it very much. I hope you can hear me okay. And thank you again, Ashley. I appreciate it. It's an honor actually to be able to share my story, especially because I just recently had the opportunity to share it with the National Cancer Institute, for their survivorship series. And so for me, it's kind of, a hot topic, or I'll say near and dear to my heart. But it comes fresh, I guess, from being able to rewrite it or even relook at it again or think back to the time. Um, and so I'm going to kind of highlight a couple of the things that was asked by me through the National Cancer Institute, just from some of the probing questions that they asked, and then respond to you or share based on my answers at that way. So what was life before you were diagnosed with cancer? So I will say it was just beginning. I was just newly married. It was July of 2006, and I was just figuring out things with my husband. We were beginning conversations of starting a family. We were happy. We were in our jobs, our careers. I was with the American Cancer Society. Things were stable, and things were just me trying to figure out life, right? What a newly married couple does. How did I find out about cancer? I found out through a routine pap test, and I have to admit, I was too old to be able to get the HPV vaccine, and at the time, it was not a conversation that we were ever having or talking about at that time. And so I found out through a regular pap test. I have to admit, though, I did not want to go to my appointment. 2 months prior to my appointment, I had a stroke that I was still dealing with side effects from. And dealing with going to medical appointments and dealing with blood work and just another unexpected twist in my life. what I know now is that the cervical cancer actually is the reason why I had the stroke. But because my blood levels were all off. And so I ended up falling in the bathroom one morning, and that's what caused the stroke, and which nearly took me in a different direction. However, I wanted to put off everything. I was putting off any type of screening appointment that I had because I was so focused on that at the time. But I have to admit that my close girlfriend Susie, who is actually now a breast cancer survivor, reminded me that I never missed an appointment and really pushed me to go and get my screening. And so thankfully I did. And I thank her all the time for her reminding me that that's important to do, even though I work for the American Cancer Society. Um, at that time, I was diagnosed early stage, was caught very early, and it was because of HPV. And so it was a shock. It was for me, it was a shock and a dismay of that I couldn't believe what I was really even dealing with, especially working for the American Cancer Society. I was in disbelief. I was asking the questions, why me? Why this? Why now? I had all those kinds of questions. Um, what were some of my experiences related to side effects? Because I was an early stage cervical cancer survivor, I had several options and choices. However, the choices that were really put forward to me were surgery, and that was to have a full hysterectomy. And I chose that, giving up the decision to have children of my own. It was a struggle and a decision that that I don't regret, and I'm thankful for the support of my husband, but I do know now that it was probably the best decision that I made. And so I chose to have my surgery in November of 2008, which is within about a month to 2 months after my diagnosis. Um, who was there for me for my diagnosis? And I have to say, I was lucky and I had everyone around me. I had from family and friends to my new husband to my stepson, Brock, who actually let me just kind of lead him in a way of being a stepmom, giving me the opportunity to play a role in his growth, which was to me at the time I needed most. I had immediate family and friends all around me, that I thank every day for. But I will say that the American Cancer Society was there for me as well. Being a staff person, not knowing enough about cancer, not knowing enough about screening or even HPV, I was able to get the information and the guidance that I needed from an organization that I trusted. And that to me was so important. Um, what was helpful for me? I will say that having the information was helpful, getting the facts, and remaining positive. There has been times that I wanted to fall apart, but I did jump right back in and just kind of make things happen. I will say that in my role now with the American Cancer Study, I work with healthcare systems, making sure that they align with programs and services, but also screening and HPV vaccination rates. And so I use my voice as much as I can to make sure that we are sharing the best practices and that we are working together to end this disease. And I also want to say that I actually had the opportunity to work with several health systems during my stroke and through the cancer, which actually watched the dialogue between two different health systems work together. And so that to me was huge, having two Michigan health systems working together. That don't typically work together, right? And so having my medical team around me was one of the greatest opportunities that I had as well. There are many things that I can say about what's next and goals and priorities. I'll just say next is life, and that's what it's been for me the last 19 years. I'm living life as best as I can. I do things and I say no. I think that's one of the biggest things that I've learned more than anything is that I've set myself as a priority and my family around me as a priority. And I lean on those that have questions, and I lean on those that who can help me kind of guide my own next best decision. Um, when I was asked in the NCI group to share my story, I was all over the place, and so I had to reflect on who could I thank and who do I appreciate the most. And I will say it's the people who surrounded me with information and guidance. It's those that made the time to provide me with the facts, those that made the time that showed me what does it look like to have cervical cancer, whether it's drawing a diagram on a piece of paper or showing a chart up on a screen. And so that is what I think I'm most thankful for is that I had the team around me that could help me make the best decisions that I could during my time. And so I'm happy to say that I'm 19 years out this year, and I'll do anything I can to make sure that people know that it's important to get vaccinated, but it's important to get screened. And so if that's the message that I can give today or tomorrow, I'm happy to do that. And thank you.
Thank you so much, Jen, for sharing your story with us and for being a part of today's session and being a part of the American Cancer Society. We are really, really lucky to have you. You really were vulnerable in sharing your powerful survivorship story with us today. And your openness and willingness to speak so candidly helps to ground, the work that we're doing here, around cancer prevention and screening efforts. So thank you so much and appreciate you. So we are now going to transition to our panel discussion on trusted voices and community messengers. That'll be the large part of our session today. So I'm excited to introduce Dr. Ashanda St. Jean. She will serve as our moderator for today's conversation. So Dr. St. Jean is a proud graduate of the Sophie Davis School of Biomedical and Education at CUNY Medical School and earned her medical degree from the New York Medical College. She completed her residency in obstetrics and gynecology at Danbury Hospital, a Yale New Haven affiliate in Connecticut, and is a board certified OBGYN physician. In addition to her clinical expertise, Dr. St. Jean has held numerous leadership, academic, and advocacy roles throughout her career. We've included her full biography and a way to connect with her into the chat. And in the interest of transparency for our CME and CNE participants, I would also like to note that Dr. St. Jean serves on Pfizer's Speakers Bureau. So, Dr. St. Jean, thank you for joining us today, and I'm going to turn it over to you.
Thank you so much. And thank you everyone for joining us. First and foremost, I just want to applaud Jennifer for sharing her story and grounding us on the lived experience of what really happens when someone has to go through that cervical cancer stage. And so, in knowing that she's 19 years out, I applaud her for sharing that with us. Now, turning over to our panelists, what we want to discuss is also kind of arriving at what it means to be a trusted messenger, right? Because we know the lived experience, but now, in the present climate of today, we have to tackle kind of where there is some miscommunication, there's misinformation, there's vaccine hesitancy, and how do we foster vaccine confidence in the presence of trusted messengers? So I'm going to start off with our panelists. I'm going to start off with Dr. Bell. Dr. Bell, please tell us, what does it mean? What does a trusted messenger mean in your work with HPV vaccination and cervical cancer screening?
Yeah, so thank you, and very honored to be a part of this wonderful group and this wonderful discussion. So I work mostly with tribal communities, and what we see in a lot of tribal communities. Again, recognizing that we have we have 575 federally recognized tribes, meaning that those tribal nations are sovereign entities, and so they have a unique relationship with the federal government. And so when we talk about trusted messengers in tribal communities, obviously there's a history of colonialism and racism and exploitation through healthcare and research. And so really the trusted messenger is a role that develops over a long period of time. And so we have to be respectful of the thoughts and feelings of the community and recognizing that history. And so in the work that I do, obviously I am a member of a tribal nation, the Lumbee tribe in North Carolina, but I have to be respectful for other tribes that I work with. I don't know their history. I'm respectful of that, and so I think it's just very important that we we come to the work recognizing that history, recognizing that culture, and identifying those people who can make that connection and almost kind of walk in those two different worlds.
And I think what also we have to ground ourselves in is kind of trusted messenger equals respect, right? And also connection and bridging of communities that may be different or the same. So Dr. Jennifer Moloku, I want to pronounce your name correctly. Please kind of give us your take on what it means in the work of HPV vaccination of being a trusted messenger.
So thank you. Um, so I'm a family physician and I work in El Paso, Texas, and also direct an HPV, a grant-funded HPV, CPRI grant-funded HPV cancer prevention program, which helpfully has given us funds to be able to reduce the cost barrier to the HPV vaccine, which we know is very expensive. I did want to highlight a couple of things to that question. And even though that the sense in the country now is that people are very distrusting of healthcare professionals, I think it's important to remind anyone who's in the healthcare space that they still serve as a trusted messenger, right? So that is the first. All of the studies have shown that, people are more likely to get their HPV vaccine if that information is broached to them by their healthcare professional. And so we still serve as trusted messengers, despite what it may sound like on social media. The second thing for us that we found really helpful, and I think it goes to the point that Dr. Bell was making, is really having community members who are trained to provide this education. We use community health workers a lot in our programs, and having people who speak the same language, who have similar backgrounds, similar experiences, we find is really pivotal in helping to break down some of those barriers.
Thank you so much. And, and I think as we kind of talk about cultural congruency, cultural respect, and cultural similarities, right? We are trying to, what we want to do is serve underserved communities that may have a unique history, cultural experience, be respectful of those, but also how do we build those relationships, especially in healthcare and in the present climate. So Dr. Vazadevan, can you please kind of tell us what your take and what your experiences is and where you're at in the United States?
Thank you very much. So I am a global health and implementation researcher, and I've worked for over a decade on developing, implementing, and evaluating strategies to improve vaccine uptake, both in community and healthcare settings. And a majority of my work is focused on supporting families with childhood and adolescent vaccination decisions. And so I was fortunate to be part of a multidisciplinary team that developed and implemented a program called INVEST, which was a school-based program designed to promote adolescent HPV vaccination among youth in rural communities. And I was happy to see a number of school nurses on the call today. So what made INVEST unique was its focus on trusted messengers and a comprehensive health approach. So specifically, we partnered with school nurses who are highly trusted sources of health information for both students and families. And the way we approached the communication was we integrated vaccine education through the nurses into broader conversations about adolescent health and well-being. So we were able to discuss vaccination, not in isolation, but we positioned it as one component of supporting healthy development, which is what our rural communities wanted from us. So going back to that concept of respect, it was very important that vaccination be promoted as part of a whole health approach. So our program demonstrated how trusted relationships in a broader health context can help strengthen vaccine communication, and we saw a meaningful increase in HPV vaccination rates in the rural school districts. For those of you who are interested, the materials are freely available, and I'm happy to share that resource. But to me, a trusted messenger is someone people already know and trust to provide reliable information and guidance. So in our work, school nurses were the trusted messengers because they had established relationships with students and families. They really understood the needs of their communities because they came from those communities, and they were well positioned to already have those open and credible conversations about health.
And I think what you're showing us is these strategic measures, right? These are opportunities for us to really build upon the importance of education, but also having community within community. And I love to hear about your strategies in working in the schools and utilizing the nurses. And I'm so glad that we have so many nurses attending today. So I'm going to head it over to Dr. Adeya Beja, I want to say correctly, but please give us your strategies. What's the significance of trusted messengers? How does that aid in cultural competence care and respectful care as well?
Thank you. Yeah, Dr. Adegboyega. I'm a community engaged researcher and also a nurse scientist. And so most of my work is done in the community setting. For me, a trusted messenger is someone who is respected within the community and they know how to communicate unbiased, culturally responsive, and credible information to the community that they serve. So in my work, most of the individuals that I've used as trusted messengers are faith leaders, young adults, community health workers, peer educators. So these are people from within the community. They understand the community values. They understand the culture. Just like Dr. Moloko said, they understand the language and the lived experiences of these individuals that they serve. And so they are able to share information with the group in a way that feel very credible and culturally relevant and respectful to the group. Then, in terms of cultural competency, we make sure that these individuals are trained and so that they are able to, and they also have cultural humility because that's something, even if they don't have a full grasp of the culture, they are able to come to an understanding that there's something that they need to learn. They don't want to make themselves the authority in the culture, but they are able and vulnerable enough to learn from the community that they serve. But we try as much as possible to pick individuals from within the same community so that these are people that are already known by the community so that they are able to do what the community wants. I'll put it at that. Thank you.
Yeah, and I love what you said about kind of looking at the trusted messengers as different members of the community, right? They could be peers, they could be community health workers. And, I think collectively what all of our panelists have said is that, we are all trusted messengers, right? And we have the opportunities to kind of root that work in respect and cultural congruency, similarities, relevant care, but also be community within community. So now kind of let's talk about how do you navigate the challenges, right? So we have that strategic approach. We have kind of the tactical efforts that you all have done, but how do we navigate the challenges? Dr. Bell, do you want to start us off?
Yeah, I mean, obviously there are deeply rooted challenges in many of the communities that we work in. So we, it doesn't always come easily, but I think working within the framework that is part of the community you are working with. I think, and that's part of being a trusted messenger. You recognize what those challenges, what those barriers are, and so I think having the ability to so if it's a language issue, if there's certain words that resonate as it relates to communicating a health message, then utilizing those words. If it's certain imagery, if you're developing print or audiovisual materials, using that imagery that resonates with that particular community. If it's addressing a logistical barrier like having clinical time after hours, or providing transportation, or things where those logistical barriers are addressed, then working within that framework, I think is very important. But I think too, in trying to think specifically about how do you communicate the importance of, in particularly in light of what's been going on in our country, the importance of HPV vaccination or vaccines in general. Just understanding, some people do have these concerns, and how do you communicate that in a way that will reach them. And I've had conversations with some of the pediatricians in our tribal community, many of them who are members of our tribe, and they said, look, the first message I say is, this is the health of our community. These are the statistics that show we have a problem. This is the solution. And that, I think that resonates with a lot of people, that communal, I want to be a part of a healthy community. And so I think that's a really important message to get across.
And when we talk about challenges, right? So we could talk about the misinformation, right? And we all know that everyone is immersed in social media now, right? But then also what I was hearing from you, Dr. Bell, is kind of also aligning the challenge with the social determinants of health, right? So transportation, access, availability. So please, any one of our other panelists, please jump in and tell us about how you address those challenges that you may face, and what are strategies that you may have used.
So I wanted to add 2 points. One is really to agree, and Dr. Bell, Dr. Boyega pointed to this about understanding what the community needs and their concern. A few years ago, when we were actually during the pandemic, when we were looking at social media messaging for our HPV campaigns, because we couldn't do our person-to-person campaigns because of a lot of restrictions around the pandemic, there were certain things that we found that were highlighted, right? So that when we were thinking about messaging is different for different people, depending on the group and depending on what the group wants, right? Young people were more concerned about warts than they were concerned about a future abstract cancer. Parents were more concerned about preventing cancer than warts. And when you looked at our community, El Paso is largely Hispanic, the message about protecting the community was more meaningful, impactful for them than individual responsibility or individual protection. And so those were the messages that resonated with them more. And I'm sure that there are groups where individual like being able to take your health in your hands and protect yourself is a message that resonates more. And so one is understanding what what the needs are for the group that you are, because it's usually not a one size fits all when it comes to messaging and breaking down barrier. And then when we went to looking at logistical social determinants of health barriers, again, like I said, we were lucky that we had funds to pay for the vaccines, because the vaccines are insanely expensive. And if anyone has powers to get the cost of those vaccines down, please. But aside from that, there were all of those logistical challenges. People getting transportation. It's a 3-shot series. Getting the follow-up shots, making the appointments, and doing all of that. Part of what we did was partner with our community. We developed a partnership with Walgreens, because many communities have a Walgreens at or around close by them. We developed partnerships with Immunize El Paso, which is our local immunization group, that has multiple spaces. So apart from going out to the community and being able to vaccinate people at health fairs, at school events, we were able to then, when we gave people reminders for their follow-up visits, if they didn't have close access to their healthcare, we were able to get them a voucher to either Walgreens or Immunize El Paso that was closest to where they lived, so that we tried to limit how much traveling. And plus the advantage of the flexibility with timing for places like Walgreens because they're open on weekends and in the evenings.
And what I want to say is, like, this is what we need to share with our audience. This is efforts that were community driven, but also listening to what the community needs and how they interpret it. And then even extrapolating that information based on generation, right? What the parents concerned about and what the children were concerned about, and kind of really also having community partnerships with like Walgreens. So tremendous. I just can't applaud you enough for that. Does anyone of our other panelists want to join in? Please.
I'll just add to everything that's been said with an example from our INVEST study. So one of the things the school nurses really wanted us to do was include information on vaccination providers in every single newsletter that we sent out to families. And this was important because we were working in rural settings where providers may or may not be stocking the HPV vaccine. So we actually went through the task of identifying providers who are routinely stocking the vaccine and including their information on newsletters, identifying which insurance plans they accepted and noting that. And so that was a big ask that we thought was very important to fulfill. From an implementation perspective, one thing I will mention is that oftentimes trusted messengers are people who are very busy. They're doing a number of important things. So time and competing priorities are biggest challenges from an implementation perspective. And in our INVEST study, we were really fortunate to find champions within our school district. So these were lead school nurses who were really instrumental in advocating with the school district leadership for the rollout of our program, organizing the school nurses, making sure that the materials were being sent out. So I think from an implementation perspective, having those champions, even if you are working with trusted messengers, I would say is super important.
Yeah, and I think also we have to also really kind of delve into having champions that can overcome the challenges, right? And so Dr. Adeyo Boyega, can you please kind of tell us about what the paths that you have traveled to kind of really arrive at HPV vaccination?
Thank you. So for most of my work, maybe I'll talk about one study, and it's called hashtag HPV Vaxtalks. So this was a study where young adults were encouraged to get vaccinated. And for this study, we used the Youth Community Advisory Board. So those were the individuals that really helped us to create the messages. And we were able to create like 40 messages that we disseminated on Facebook. But this was not like a general campaign. It was for people recruited to the study. And I say that because I know at the beginning of the conversation, we're talking about misinformation, a lot of misinformation on social media. So I decided to take this approach of using social media because this was something that I know that the youth were really interested in. So I focused on 18 to 26, they were not vaccinated. And so they are going to be on social media anyway. So why not just leverage that? And of course, over the years, social media has changed. Facebook is no longer for the young adults. They are now on other types of social media. But at that time, it was very relevant to them. And the Youth Community Advisory Board really helped to create the message that we needed to put out there. They helped me with creating the memes, which was something that was very new to me at that time. But that was something that they felt would really resonate with the group that we were trying to appeal to. And one thing that is that we also created a constant feedback loop with this YCAB. We took the messages back to them, and then they also helped us recruit into the study. And they came back to tell us what they were hearing so that we addressed those challenges as the study went on. So that's something that I've done with a youth community advisory board for young adults. And then for other studies, we've used faith leaders, just like I've said. Many people respect their pastors, they respect their imams. So the studies that I've done in churches, faith leaders tell them about the importance of getting vaccinated, of getting screened. It doesn't only protect you, it protects your family and your future generation. So if you put it in a way that resonates with their faith, then this is something that also helps them to have that behavioral change that we're hoping they will have from the messaging.
And I think what we all face today is competing with Dr. TikTok and Dr. Google and Dr. WebMD. And so recognizing that we have to use kind of that barrier of misinformation to our benefit to develop, community youth advisory boards, which I think is magnificent, is, really understanding what the message should be. Who are we focusing the message to? And we may need to have more than one message, right? If we're kind of addressing two different cohorts. And I think these are the strategies that we have to develop and utilize so that it will help us increase the uptake and implementation as well. So I hear what you guys are saying. And from all of your different strategies in your own realms, what are the best lessons learned and that you can share with our audience today? And just jump in.
So, I can start. I think one thing that I've learned is if you're going to use people as trusted messengers, especially as a community engaged investigator, one important thing is to start by building relationships. You just don't want to start by going to them for a favor about research that you want to conduct. You really want to be present in the community, even before the study starts. Even before you bring the idea of research, you want to build that relationship. Show up for them when they're having an health fair. So I'm a nurse and I have the skills. I can show up, give a talk in their health fair, give a talk in the church, in the community center. I can give a talk. And so this builds relationship. And so when you come to them for a favor or to ask them that, oh, you're looking to do this, they are able to bring their skills, they are able to support you to do that. So that's one lesson that I've learned.
And I think that's important because, again, we don't want to show up just randomly. We want to be embedded within the community. So it's community within community. And I think also there are many different programs that are using alternate messengers, right? So they're using pharmacists, they're using dentists, right? For education, for even to, really fortify the message in the education and the importance of vaccination. Dr. Bell, you want to jump in and tell us lessons learned from your standpoint?
Yeah, I would say, trusted messengers as change agents, where we talk about system change, it can be very powerful. And like here in North Carolina, being American Indian is part of the North Carolina Vaccine for Children's program. So all American Indian children get vaccines for free and no questions asked. And I didn't know this. I was doing a focus group with some providers in one of our tribal communities, and they were like, "Yeah, of course, all of our Native children get free, all of their vaccines for free." I was like, "Well, that's great to know," but somebody advocated for that, and so that's a system level change that eliminates a huge barrier, and so. That to me is just a very important lesson that there are ways that people can advocate for these major addressing some of these major challenges that face our communities.
And I think that's magnificent that you had such a trailblazer to make sure that these vaccines were free of cost. And I think those are the game changers, right? And that is one of the ways that we really tackle the social determinants of health, depending on access, insurance type, or even availability. Our other panelists, do you guys want to weigh in on lessons learned?
I'm happy to add the big thing that we learned with our studies is because trust is so central to how people process health information. I think it's very important to identify individuals who are skilled communicators and relationship builders, as other panelists have said. And these are often people that others turn naturally to with questions because they can help facilitate open conversations that support informed decision making. The one thing about vaccinations is that when it comes to vaccination decisions, we find that more information isn't always the answer. What matters in a lot of cases is how people process that information and who they trust to help them process that information. And so when we think about trusted messengers, we think about people who can provide the context and the perspective that make the health messages more meaningful and effective. And again, when you draw from the communities, you can find individuals who have that cultural humility and the knowledge and alignment to do that. And so I would say that was one of our biggest lessons learned.
I love that. I love that. I love aligning the community, the cultural humility, but also having skilled messengers who are able to have those sometimes complex conversations, because sometimes it's not a one-off, sometimes it's a repetitive conversation, and sometimes there's a multitude of questions. So I really, really appreciate that lesson learned. And Doc, our last one, please tell us your lessons learned.
So for us, I mean, what we're trying to do is actually build a generation of trusted messengers. Because we find that for behavior change, the subjective norm is really important. What is normative in your culture? There was a time, and it feels wild now, where you told people that there was a shot they needed to take, and people lined out outside the store, put their arm, got their shots, and moved on. It was because it was normative culturally. But then the more we knew, the more we started to hear about side effects, the fears crept in, the doubt came in, and now it is no longer culturally normative, not for any particular culture, but just as in the US as a culture and worldwide, to get vaccinations. And so we are working, or we've worked to develop a youth health advocacy training for high schoolers, where we're training high schoolers to understand at a basic level what vaccines are, why they're important, the history of vaccines, so that they can go out and become peer advocates for their own peers and have these conversations in a teen normative cultural way. Because I think that if we can impact a generation where it then becomes more normative to say, yes, vaccines are something we do to protect ourselves, to protect our families, to protect each other, then hopefully we have some hope of turning to the tide. I mean, this is our pipe dream, but we're starting small with a pilot in our corner of El Paso to get that.
And I love the usage of framing it as a cultural normative, right? Because, like you said, this was the norm. This was not even questioned. And so, fortunately for us, we have survivors like Jennifer who shared her story. We have peer advocates, as you said, and there are opportunities where we can move forward, where we can educate, we can be those trusted messengers, we can actually combat misinformation. We can have community awareness. We can use community partners, use faith-based organizations to really kind of spread the information, the knowledge about the importance of HPV vaccination. So what I want us to kind of leave with, and we're going to just do a round table or rectangle. I'm going to have all the panelists kind of give what they think are key strategies or advice for others when we kind of think about the guidance that should be used to really fortify trusted messengers, but how we can increase the uptake of HPV vaccination, and we could eradicate and remove cervical cancer as a cancer in totality. So who's going to start us off? Dr. Bell, start us off.
Yeah, I'm from the South. You shouldn't put the guy up here first. That's against my culture. Yeah, and I'm looking at JT's question here too. It is challenging because you want to support people that that do this kind of work. You don't want to have them do it on a volunteer basis and take advantage of them. So obviously finding some sort of support for people to serve in this capacity is important. I would say, and particularly, which is why we try to go to as many powwows and cultural events across the state as we can. And people just need to see you, and so building those relationships by showing up to places where people go and represent who they are, I think is very important. I think too, and I love the ideas that have been shared. We have a youth health ambassador program. So we Native high school kids, we train them to go out in their communities to talk about the big three cancer risk factors in their age group: HPV vaccination, sunscreen use, and vaping. Vaping's a huge issue now. So I think having that capacity to because we tell them, hey, this looks good on a college resume. So you want to make sure if you want to go into a health profession after you finish college, then we'd love to help support you in that role. And so I think those are just some ideas around maintaining that presence, but also maintaining momentum to keep this work going.
Thank you, Dr. Bell. And when we think about the maintaining the presence, the momentum, the kind of the importance of peer involvement, right, and advocacy, what are other kind of advice that we can impart to others? Who wants to jump in next?
I'll talk about training, especially when you're doing the work in the community. Even though these individuals are trusted, they're good communicators, they still need the training. Many of them are not used to research or even campaigns. And so you want to make sure that you give them the resources that they need to be more credible. They're already credible, but you want them to be more credible. So training is important. And you want to build authentic relationships so that it's not very transactional, but that they're passionate about this, and with the authentic relationship you have with them, they are able to even continue with the work, especially in terms of research. When the grant funding ends, you need people that will sustain the work, and these are people that are really committed to their community.
And the work doesn't end, right? And so when we really want to have that presence in the community, like you said, it can't be transactional. We want to be one with the community. And Dr. Malosco, what would you say are advice that you can impart to others?
I think it's really fine, passionate champions, messengers. I think to Jennifer's point was elevate the voices of survivors, right? Because my point about subjective norms and how this has become less normative is that the less we see of diseases and the higher it then makes the treatment or the intervention seem seem worse. And so people need to hear that these are still conditions that are ravaging people in our society, and that this is something that there's a prevention to. So finding those passionate champions in elevating the voice of survivors is important.
Yeah, and even kind of just like you said, magnifying the importance or amplifying rather of prevention, right? And what HPV vaccination does. And our last panelist, please impart with us our guidance and what points do you think that you can offer our audience?
I think I would really echo the point about training the trusted messengers. Over several studies, we have found that even if we find individuals who are clinically trained, have a lot of knowledge, and feel that they have the avenues to do the communication, where they lack confidence is in that final step where they feel like they cannot change people's minds, right? So even if they say something, they're not going to make a difference. And so a lot of our training focuses on communication techniques, motivational interviewing, and such, where we are talking about how this is a process and it needs to unfold over many different interactions. And so that brings me to my sort of strategy, which is we always take a proactive approach, meaning we provide information before it is needed. So for our school-based intervention for seventh grade vaccines, we start in sixth grade, right? Providing information over the course of the school year so that by the time they come to seventh grade, they've received enough information to be ready to make that decision. And so being proactive and working with those trusted messengers, supporting those trusted messengers in what we are asking them to do, I think is important.
Well, I just want to thank this panel for all that you're doing. You guys are amazing and just really made it more granular, the importance of training, prevention, having trusted messengers, and just having those that are skilled at having those conversations that are rooted in cultural humility. So I thank you. I'm going to hand it back over to Ashley, but and we will be doing questions at this point, but thank you all of the panelists. You guys are all amazing.
Thank you so much to each of you for being a part of today's session and for sharing your insights and opportunities with us and just inciting with us all of the great things that you guys are doing in your communities with trusted messengers and community voices. And I appreciate you guys also sharing on JT's question. I know that was very important, and you guys really touched on the importance of building strong partnerships, and it takes time to do that. So thank you all again. We are going to wrap up today's session. We're going to do just a quick poll and share some resources to support your work and talk through next steps. So we'll go and launch that poll really quickly. If you could just share with us how familiar you are now with trusted messengers after today's session and discussion. Let us know if you can identify a specific trusted messenger to partner with in your community, and go ahead and select one for us so we just can see who everyone is hoping to work with. And while you're doing that, I'm going to just move forward with some other information so that we can stay on time. So for those that have missed the announcement, we have a new landing page on cancer.org within the ACS's knowledge translations section. So it includes an overview of the ARC network, which is how we do implementation science here at the American Cancer Society. And this landing page serves as the hub for the rural learning community, where you can register for our sessions, access past materials, and explore shared resources. So I highly encourage you to bookmark and share this link. We've placed a link into the chat for you to look at. If you want to go to the next slide, the Learning Materials Library is your central hub for everything from session recordings to slide decks and CME information sheets for each of the sessions. And this dates back from when we first started back in 2024 to our current sessions. So you can revisit any meeting at any time using this Learning Materials Library. If you want to go to the next slide, I do want to point out we also have a resource roundup, which is a one-stop hub for ready-to-use tools and materials. You'll find a wide range of resources, including continuing education opportunities, templates, and even resources dedicated to communication and trusted messengers. I've actually even added some links from our panelists' work to the trusted messenger section. So I highly recommend that you check that out. If you want to go to the next slide. As we wrap up today's session, I'd encourage everyone to think about three key actions you can take back to your organization or community. First is consider who is a trusted voice in your community, whether it's faith leaders, school nurses, community health workers, or other local champions. These individuals can play an important role in promoting HPV vaccination, other cancer prevention, and screenings. Take time to listen to community concerns and work with these messengers to deliver information in ways that will resonate locally. Second, make use of the resources that are already available to you. Ensure your messages reflect the language, the culture, and values of the communities that you serve. Equip trusted messengers with evidence-based information and consider using personal stories and lived experiences to make your outreach more relatable and impactful. We've also shared many resources throughout all of our sessions, including the resource roundup. We also have our HPV vaccination social media toolkit, which includes outreach materials in both English and Spanish, along with culturally relevant images and ready-to-use content to support your engagement efforts. And finally, think about how you'll evaluate your efforts. Gather feedback from your community, monitor changes in awareness and engagement, and where possible, track vaccination and screening rates. This information can help you to understand what's working and identify opportunities to strengthen your approach. If you want to go to the next slide. I want to thank you all for joining today's session. We took the month of July off, but we are back. And next month, we are going to have a session on HPV completion rates. So very excited for that session. We'll see you again on September 9th. And thank you again.